We had a very rigorous selection process, which I don't think every vendor could survive. And so the flexibility and the endurance and the consistency that Axolotl demonstrated was very important to us. And that was really part of the rigor that we put into the selection. If you can't survive the selection process, we don't want you as a technology company.
We started to evaluate those vendors who actually had something running as a clinical information exchange system where real doctors and real hospitals and real clinicians were exchanging information between and among each other. The list became very short. Axolotl rose to the top of that list primarily because they had a simple model that worked. It provided an opportunity for physicians to begin to adopt electronic workflow processes at the physician's pace.
We had a community demonstration process which involved 65 people separated into 4 groups. It was a 2-day process, and they were there for every part of that. And they did a superior job, and it was very clear after that process that they were the vendor to pick.
Western New York Clinical Information Exchange went through a long and exhaustive process to select their technology partner. We looked at a number of factors, but the key factor in selecting Axolotl really was with respect to how the physicians were able to interact with other physicians using the technology and receiving benefit. I mean, technology is wonderful, but if it's not driving value and results within the physician office, then it's not worth it. It's not what we're looking for. So what we found is that our physicians talking with their counterparts, their peers at other Axolotl customers, were able to understand how the technology could be applied to their situation. And that was the strongest reason. It's really physician use of the technology, acceptance of the technology, driving results, driving utilization, which led us to the decision to select Axolotl.
We actually looked at some of the practices and did a return on investment analysis of them transitioning from paper to clinical messaging and then to a data-connected EMR using Axolotl connectivity. So that was one return on investment analysis. The other was looking at the results deliverers, the results senders, and we actually broke that down into the hospital's radiology department, their medical records department, and their lab business. And we made sure that the return on investment was a valid one. It was a very hard ROI that these department level folks believed in, and then that the senior leadership group at the hospital said, yeah, I believe this is real. The ROI analysis clearly showed that clinical messaging was the thing to do.